Hello and welcome to this week's edition of the Get Healthy Talladega County Show. I'm Lori Corley. Today we have a great guest with us, Margaret Morton, who is the Executive Director of Safe Family Services here in Sylacauga. And with us today as well is Joel Taylor, who is the CEO of Citizens Baptist Medical Center in Talladega. We're going to be talking, this is second in our two-part series on Medicaid and the state of Medicaid in Alabama, and Joel is going to give us his insights from the hospital in Talladega. I hope you've seen our recent show with Glenn Sisk from Coosa Valley Medical Center. So stay with us, we'll be right back, and we hope you learn more about the state of Medicaid in Alabama.
Recycling, it's nothing new, but how many of us actually do it? What's the point? Every time you toss out something that could be recycled, you're throwing away money. Recyclables are valuable, and when items like these are recycled, they are sold to businesses and made into new products. Alabama's recycling industry employs thousands of people, and more recycling equals more jobs, which equals more money put back in your local economy. See, recycling just makes sense. Let us show you how recycling works in and for Alabama.
What time is it? It's Toyota time at Toyota of Sylacauga.
This is a great time to own your new Toyota from Toyota of Sylacauga. We have truckloads of new inventory arriving almost daily. We provide transparent pricing, great service, and a no-pressure buying experience. Right now, all new 2016 RAV4s, Corollas, and Camry have big discounts, plus 0% financing available.
We're your small-town dealer with big-time savings. Online 24/7 at toyotaofsylacauga.com.
Camping World would like to introduce you to a whole new world. Say hello to a fresh day. Step out to adventure. Explore and discover an amazing world. Be in arm's reach of wonderful. Camping World, the #1 RV and camping expert, wants you to say hello to a whole new world.
Say hello to great deals during the RV sales event. Visit your local Camping World today.
The gift you've been looking for is waiting at Carden's Gift Cottage on West Fort Williams. Our friendly staff will show you cool raincoats and all kinds of carry bags, neat signs and heavenly scents, colorful lamps and fun beds for the kids, custom car tags and monograms and just about everything. Plus, new items show up all the time. We'll even wrap it for you too. Heck, we'll even rent you a U-Haul trailer or truck to get it all home. All this, and we make keys too at Carden's in Sylacauga.
And welcome back. We're so glad to have you with us today, and we're very fortunate today to have Joel Taylor with us, who is the CEO at Citizens Baptist Medical Center in Talladega, and also Margaret Morton, who is the Executive Director of Safe Family Services and the lead agency for the Get Healthy Talladega County Network. So welcome to both of you. And Margaret led the discussion with Glenn Sisk from Coosa Valley on our last show, and I think many of the things we're going to talk about today are the same, just getting a different perspective from the other end of the county, but also you all have had a name change and some different things going on. So Margaret, you want to take it away?
Well, I think you've sort of led right into the introduction. Joel, we are glad to have you with us today.
Thank you for having me.
Why don't you sort of begin by telling us what has been happening in your corner of the world over the last year or so?
Okay. Well, again, thank you for having me. And it has been an exciting time at Citizens Baptist Medical Center. We are now part of Brookwood Baptist Health. It's been publicized, but people are still learning about. We have done a recent joint venture with Brookwood Medical Center in Birmingham, who is owned by a corporation out of Dallas, Tenet Health. And Tenet and Brookwood and Baptist Health System have come together to join as a joint venture, and collectively now have 5 hospitals, over, I think it's 70 outpatient clinics across Central Alabama, making us the largest healthcare provider in Central Alabama. And for Citizens, this is a significant step in the right direction. We as a community hospital remain focused on delivering exceptional care, especially to those patients in North Talladega County, but to integrate more with Brookwood and to draw on their resources. And the resources that Tenet provides, I think, helps us take the next step in an ever-changing healthcare environment. So for Citizens in particular, some early changes have been the logo. I think the new logo was part of the intro to the show, and that was unveiled in early April. And so that's one tangible piece that people have seen. But also we have physicians that are affiliated with Brookwood that are now coming out to Citizens, both in anesthesiology and orthopedics as well. So a good partnership thus far.
So the day-to-day operations are pretty much the same if you walk through the door, except that when you walk through the door, there's an expanded opportunity for service.
Exactly. It's the same. It's the same people. The same nurses that have been there for 30 years are still there today. It's not our mission changed only slightly. We are still a faith-based organization and keeping patients at the center of the focus. And so, but I think strategically, that's really where the change will start to happen. As healthcare continues to change, that's where this relationship will be most beneficial.
Now, you've been in our corner of the world for about 6 years now.
Almost 6 years, and it's been quick.
Yes.
Yeah. Yes.
Could you sort of give us your background and how you came to locate yourself and your family in Talladega, Alabama, and Talladega County, and then we're going to talk a little bit about the relationship that has been developed across systems through Get Healthy Talladega County.
Fantastic. Yeah, happy. I have been here almost 6 years, and when I hit 5 years, I was remarking to Marcia, my wife, just how quickly it's gone by. But in that time, gotten to meet and know a lot of people. Prior to Talladega, we were in a small town in East Tennessee, Sparta, Tennessee. I grew up in Nashville, so for me that was getting closer to home, because I left Nashville, went to school in Birmingham, worked in Birmingham, and then on to Decatur. Have been in healthcare my entire career after finishing graduate school at UAB.
Yeah. Now you were at Birmingham Southern, right?
I did undergrad at Birmingham Southern. So I'm a big fan of Birmingham Southern and the Panthers, and every now and then kids from Talladega and Sylacauga will end up there. So
yeah, we've had I've had friends that have attended Birmingham Southern, and then my friends of my children's friends have as well. So it's a wonderful school.
It is. It was certainly the right environment for me. So it's a great school.
So in 2010, you found your way here.
In 2010,
Talladega.
I did. Yes, 2010, found my way to Talladega. I knew the then CFO from time in Tennessee, and so he called and said, "Hey, there's an opportunity," and I wanted to come back to Alabama. Baptist Health System had a great reputation, was doing some exciting things and making some changes, and came and visited Talladega with Marcia. And just felt like this was the right move for us.
Yeah.
You know, those folks that have moved, and I know Lori has. You move for a job, and you get the feel of the community and the job. And I'm just a big believer in fit, and it was the right fit. And so since being there, have done a lot of good things with the hospital in what is a challenging healthcare environment. And I'm sure when Glenn was here, he talked about the difficult challenges that we face as hospitals. and as rural communities in providing exceptional health care. So,
right, and I really think I want you to kind of really talk about that. I don't think your average person understands how hospitals are supported and what happens when those support systems are either there or not there, and in terms of paying customers versus individuals that come in that have challenges and things of that nature, and how that all works. When you mentioned the Baptist system, the Baptist system back in 1999, 2000, were largely responsible for creating this coalition and this work together that we've been doing since then, and sort of reinvented ourselves with Get Healthy Talladega County. But it has been an interesting journey, primarily because I grew up in Talladega County, and people would say for years there was always the North versus the South, and never the twain shall meet. But I will say that in this endeavor, that has never been the case. It has and it was led by the Baptist Health Foundation.
Gotcha.
And they came in, and what they did, I think, so strategically, was that they engaged everybody. Everybody had an equal voice, a place to go and talk about what their needs were and how we fit together as a community and a county. And so I think creating that connection has been beneficial for us to be able to continue to and sustain these efforts.
Well, that's what I was about to say. I think the Get Healthy Talladega County really provides a platform for that collaboration. I think part of the challenge, one of the challenges within healthcare, is it is though it's a wide pool of providers, they're pretty segmented. And so Get Healthy Talladega, it's when we can all sit down at the table and try and accomplish really one of the most basic things, which is improving the health of our community. It's as essential as a school system and fundamental utilities. And so I think Get Healthy Talladega, as I said, kind of provides that platform. So happy to be a part. I didn't know that history, that Baptist was kind of instrumental early on.
Exactly, and they identified Talladega County as a county in great need and came to us and helped us collectively develop a strategic plan. And then they helped us access some federal dollars to begin this work. And as with any initiatives, there's synergy at different levels, at different times, and depending on the landscape or the environment, it either is conducive to working together collectively. The thing that I'm most proud of is that that's exactly what we've done. And we've been able to come to the table and say, these are our priorities. It's not an indictment of anybody, but it is, these are our needs, and so what can we collectively do to address them?
I think, Coosa Valley Medical Center and Citizens Baptist Medical Center face very similar challenges in a lot of ways, especially in terms of what resources do we need, where are those resources somewhat restricted or difficult to access, and the changing environment of hospitals in particular. Even in the early 90s, it was a different patient population than we were seeing in the hospitals. Today, people in the hospital are quite ill, much more so than they were 20, 30, 40 years ago. And then truly we discharge at a different point and send folks home or to home health. So much is handled outside of the walls of a hospital anymore, and we are part of that continuum. But there are other significant pieces. So to come together and kind of focus collectively on the health of the county, to access behavioral health and mental health resources, to try and meet the needs of the elderly population that may have difficulty getting the support that they need, taking care of a loved one, a spouse, those kind of things. I think it has proved to be a good opportunity to work together.
And we're in a position right now where we're sort of trying out some innovations at Citizens and at Coosa Valley, and So far, with the implementation of a RN case manager or social work case manager in the ERs, we met recently with those individuals that are doing that work, and we have already seen some interesting positive outcomes that we had hoped would happen, and that we are keeping people healthier and out of the hospital.
Right.
And cared for in their home environment, which we know is much more cost effective.
Absolutely, and I'm thrilled with the work we've done so far, and excited to see what can come from that. I think it is a first step, but it's for the hospital, for the Get Healthy Talladega. It's an exciting step because it addresses an immediate need, which is effectively the ER oftentimes is the catch-all for healthcare needs when people don't know where to go, when they don't have an established primary care provider, when they don't understand completely the healthcare landscape. And good gracious, I don't completely understand the healthcare landscape at times. It's complicated. So I am excited to see what early wins we've had with the ED case managers. So.
And the issue too of even literacy, you know, and I say this perfectly honestly, that when I go to a physician for care myself, I face that low medical literacy perspective, because I can walk out of that physician's office and go, what did he tell? Did he say 3 Tylenol? And I'm confused. And I think that's true for everybody. So it's not just people who are challenged. We all are challenged at different times in our lives. So, and I want us to talk a little bit about how when we talk about a medical facility, when we talk about health and well-being, what does that look like on the bottom line? Because how do you fund all these wonderful resources that you provide, and what happens when we have challenges like Medicaid? And we'll talk more about Medicaid in a minute, but just to give people sort of a ABC 1, 2, 3 of what does it look like in your corner of the world when you're trying to balance those numbers.
Well, let's take a quick break right there and let Joel respond to that. When we come back, we can have Joel respond to those questions, and then we'll move into another segment after that and talk more about Medicaid. So we'll be right back.
The greatest threat to law enforcement isn't criminals, it's drivers. Roadside crashes are the #1 cause of death for police and state troopers. And not just them. Tow truck drivers, maintenance workers, risking their lives every day. Alabama's Move Over law requires you to safely move over when you see flashing lights on the roadside. And if you can't move over, slow down. Drive safe, Alabama. A message from your Alabama Department of Transportation.
What time is it? It's Toyota time at Toyota of Sylacauga.
This is a great time to own your new Toyota from Toyota of Sylacauga. We have truckloads of new inventory arriving almost daily. We provide transparent pricing, great service, and a no-pressure buying experience. Right now, all new 2016 RAV4s, Corollas, and Camry have big discounts, plus 0% financing available.
We're your small town dealer with big time savings. Online 24/7 at ToyotaofSylacauga.com.
Camping World, the #1 RV and camping expert, would like to introduce you to a whole new world. Say hello to new thrills. Get to know your crew. Moments become great memories. Take a new look. Enjoy freedom. Discover amazing. Say hello to a whole new world. Visit campingworld.com.
The gift you've been looking for is waiting at Carden's Gift Cottage on West Fort Williams. Our friendly staff will show you cool raincoats and all kinds of carry bags, neat signs and heavenly scents, colorful lamps and fun beds for the kids, custom car tags and monograms and just about everything. Plus, new items show up all the time. We'll even wrap it for you too. Heck, we'll even rent you a U-Haul trailer or a truck to get it all home. All this, and we make keys too at Carden's in Sylacauga.
Welcome back to this week's edition of the Get Healthy Talladega County Show. I'm Lori Corley along with Margaret Morton and Joel Taylor, and we're talking just about healthcare in general now and the changes. And Margaret, you had asked Joel a question right before we went to break, so if you want to kind of re-ask that for our viewers.
Yeah. I guess just a sort of a synopsis is sort of that spreadsheet mentality. I mean, how does this balance this, and how do you keep the doors open and the services provided? I think a lot of people don't understand how that all works and what is dependent on.
And I won't bore people for 45 minutes with all of those intricate details, but I think what's remarkable about healthcare is we've kind of got our feet in two different boats. We are still, if you come in as a patient, we are paid for the service we provide you, assuming you have insurance or Medicare or Medicaid. Mm-hmm. We are moving to a place where we will be paid based on the value, which is, I believe, where we need to go. Mm-hmm. It ensures quality care is provided. Yes. It allows for a more market-based approach in my mind, which is, if you do it well, you're going to be rewarded, and if you don't do it well, you're going to have to either respond or you're going to be in trouble. Right now, balancing those two is quite difficult. And so your question earlier about innovation, the agreement with SAFE and the grants that you guys can provide allow us to experiment with things like an ED case manager, which ultimately will benefit the patient. First and foremost, but also it helps us try and figure this new world out, which is there is nothing beneficial to us for a patient coming back in the hospital that shouldn't, or that we can better care for outside of the hospital. And so some chronic condition management, that's kind of a healthcare buzz phrase, but congestive heart failure, COPD, those kind of conditions that hopefully we can help minimize those acute episodes by better management and educating. We talked a little bit about literacy, but educating the patients and their caregivers on how to take care of themselves. And so right now, the funding of that innovation a lot of times comes from just regular business margins. And so we are like the rest of the state hospitals, having to try and balance the two.
And a couple of those are things that we are working on in our care coordination through the Get Healthy Talladega County network, with total hip replacement, total knee replacement, where those readmissions happen a lot, from what we understand, and COPD and heart attack. And our care team is really working together between the two hospitals as we can to share best practices and learn from each other. How do we take care of this person the best we can so that they're not readmitted? They don't readmit to your hospital, or the next couple of days they don't turn up at the next hospital down the road. And we had a great success story just a couple of weeks ago where in your ER, the ER care manager called and we were able to transport her back home, and we called and we borrowed a wheelchair from your hospital and that was just a wonderful way to show that symbiotic relationship that we have been trying to build, and it's coming to fruition now.
Great point. I think for us as healthcare providers and hospital operators, what is nice about this change and this evolution is it really aligns incentives from a care standpoint with the financial piece, which has been kind of disparate at times, really for quite a while. And so the ability to, what do we need to do to help this person heal, but maybe not do it in the hospital, because that's not always the best setting.
Right.
And so I think we have an opportunity to kind of continue to evolve, and this relationship is again, I've said it before, a great opportunity to let's talk about the wins and what's gone well. Let's find out best practices from Coosa Valley or other surrounding hospitals and providers. It's
and
exciting.
in those care coordination meetings, they've shared, okay, well, our hospital uses this form, but ours uses this one, and I've been so impressed that they've been willing to say, okay, well, we can try that one this time, and there's not been one who's
even the evaluation process, the assessment of the individual in terms of what their resources are, what their resources aren't. I think we're beginning to see a real coordination there across systems, and that's not just the medical, but even the social service end of it, where you're accessing transportation, you're accessing all sorts of other services that family, it may emerge that family or that individual may need, and we're having the opportunity to then take that to a real shared information system that we're working on, we're excited about, that could even further less burden the continuum of care process, so that the right hand does know what the left hand's doing, and we don't duplicate, and that patient is moved along the continuum efficiently.
Yeah, I think there is momentum there. I think everyone involved understands there's still room for improvement, and we're taking incremental steps. The technology backbone that Citizens has with Epic and within our clinics, and that I know Coosa Valley has a similar system, that ability to talk across providers. It's not seamless yet, but it's improving, and that's really exciting. So healthcare is a challenging environment right now, and a challenging business to be in, but for me personally, it's an exciting time. There's a lot of change. There's change at Citizens. We talked about the brand launch and some differences with how we're organized. But what's exciting is I believe in the direction we're moving, both as a hospital and then as an industry as a whole.
And that whole collective mentality as well. And I'm not just speaking of the Get Healthy Talladega County, but in general, which moves us into the next topic of conversation, and that is directly related to the challenges that are facing our state relative to Medicaid. And the legislature just went through their session, and we are still looking at an $85 million shortfall for Medicaid. And so, Joel, I really would like to hear you tell the Medicaid story, sort of that fact versus myth mentality, so that people can understand what is Medicaid really?
Well, in Alabama, it is a bare bones health insurance for senior disabled adults, children, and pregnant women. That covers about 1 million people in our state. So about 20% of the folks in our state are covered by Medicaid. But it is 570-ish are children. 570,000 of the 1 million are children. Another 160,000, I believe, are pregnant women,
right,
who otherwise would not have insurance. And then in terms of adults without children, make up only 60,000 of a million. So it is a safety net insurance plan that now, as you said, Margaret, the legislature has funded at $700 million, which for anybody, anywhere, that's a lot of money.
Yeah.
But if you roll it up into what it takes to deliver basic services, which, as I understand, and I've worked in Tennessee, as I said, and I've worked in Alabama. And Alabama's is not vastly different than Tennessee in terms of its Medicaid type program, but it is bare bones. It does not cover a lot. And so at funding it at $700 million, they're going to have to make some significant cuts. Probably over the next 2 to 3 months, they're going to have to make some very difficult decisions. And at least right now on the chopping block are outpatient dialysis for those folks that have end-stage renal disease that probably are also covered by Medicare but have a Medicaid secondary. And so how that coverage will really pick up is going to be scary for those individuals. And then talking about cutting eyeglass prescriptions for these folks. Again, we're talking about children, largely. So how they balance that? I mean, if over half of your population on the Medicaid rolls are children, it's going to be taxing, I know, for the folks within the Medicaid agency. It's going to be difficult to deal with as a provider. But in terms of the people that are covered by Medicaid, they're going to have the cuts. I truly am worried for them, because it becomes a situation that they don't know where to turn. And so they end up in the hospital ER that we were talking about for some acute exacerbation, because they haven't had the necessary medication, access to the physicians that they're used to. Those kind of things are real. Those are real possibilities.
And when you talk about the children, you know, Alabama has led the nation in caring for our children in terms of all kids, and that which is rolled in Medicaid, basically.
Right.
But the idea that we would go from a state that really has cared for the most vulnerable, our children and our seniors too, in a very basic kind of a way, not frivolously,
right.
To turning these folks away and creating yet another opportunity for a less healthy community physically, but economically. And I think that if there's an understanding that I think we all should have here is, number one, that Medicaid is broken in Alabama, fact or truth, truth or fiction, and the fact that that what does that mean for a private payer?
Right.
You know, how does all this build this foundation that if it collapses, what happens? And who does it affect?
Well, I would tell you it affects everybody. I think there were some solutions being brought about. The Alabama Hospital Association, other provider associations across the state had some innovative ideas that prior to the budget cut, effectively, we were moving towards regional care organizations with an implementation date of October 1. And now with the changes, that in all likelihood is at best delayed until first quarter of next year. At worst, it doesn't happen. What regional care organizations allowed was true management of the patient, where better directed care in the right setting was going to be a key component, to the point that as a hospital provider, we were expecting utilization drops within our hospital at 10 to 15% for Medicaid patients, because they would be better managed on an outpatient basis. And as a provider that gets paid by Medicaid, that was a budget piece that we were going to have to contemplate. Right. But as John Q. taxpayer and someone even more so wanting to make sure that Medicaid survives, this was a great program. This is where we needed to go. It provided an answer to what has been a broken process for a while.
The right care in the right setting at the right time. Isn't that what we say in our transitions in care community of practice? We need to take another quick break, and we'll come back and talk a little bit more about Medicaid and also other things that are coming up in the Get Healthy Talladega County Network. See you right back.
Recycling, it's nothing new, but how many of us actually do it? What's the point? Every time you toss out something that could be recycled, you're throwing away money. Recyclables are valuable, and when items like these are recycled, they are sold to businesses and made into new products. Alabama's recycling industry employs thousands of people, and more recycling equals more jobs, which equals more money put back in your local economy. See, recycling just makes sense. Let us show you how recycling works in and for Alabama.
What time is it? It's Toyota time at Toyota of Sylacauga.
This is a great time to own your new Toyota from Toyota of Sylacauga. We have truckloads of new inventory arriving almost daily. We provide transparent pricing, great service, and a no-pressure buying experience. Right now, all new 2016 RAV4s, Corollas, and Camry have big discounts plus 0% financing available.
We're your small town dealer with big time savings. Online 24/7 at ToyotaofSylacauga.com.
Camping World would like to introduce you to a whole new world. Say hello to a fresh day. Step out to adventure. Explore and discover an amazing world. Be in arm's reach of wonderful. Camping World, the #1 RV and camping expert, wants you to say hello to a whole new world.
Say hello to great deals during the RV sales event. Visit your local Camping World today.
The gift you've been looking for is waiting at Carden's Gift Cottage on West Fort Williams. Our friendly staff will show you cool raincoats and all kinds of carry bags, neat signs and heavenly scents, colorful lamps and fun beds for the kids, custom car tags and monograms and just about everything. Plus, new items show up all the time. We'll even wrap it for you too. Heck, we'll even rent you a U-Haul trailer or truck to get it all home. All this, and we make keys too at Carden's in Sylacauga.
We were just talking about the right care in the right place at the right time, the right setting. And Joel, we were just talking about over the break about dialysis and that being one of the issues one of the conditions that Medicaid, the outpatient dialysis that might be cut, and what that means for a patient. So can you take us through kind of what that means for a person?
Sure, and I think it's outpatient dialysis. It's prescription drug coverage that potentially is going to be cut, and they likely have the same effect in that their hospital stay will be paid for by Medicaid to some extent. Their visits with the physician will be paid for, though at the lowest rate of any payer to either physician or hospital. But then they can access the continuing care, be it pharmaceutical or dialysis, that they need to continue to stay well. And so, again, we're talking about a relatively small population of adults that are covered, and yet that they really, if there's not a fix in place to pay for this, there are significant economic impacts across the state, because these are people that oftentimes do work. These are pregnant women, so they're going to have to access health care still through a hospital or a provider, but it is likely going to be at a point where it can't be managed on an outpatient basis, so in a more cost-intensive setting. So I would tell you, I think there's a misnomer out there that Medicaid, as you said, was kind of this very broad covering program. It is already bare minimum by federal guidelines.
Yes.
And so for us as a state and as a community, I think we have to make a decision. How are we going to fund this? It's incumbent upon the legislature to figure out a solution. And maybe they figure it out this year, but it may be that the regional care organizations don't happen, and we go down a road of a year or two of some pretty cataclysmic problems, and that's scary as a healthcare as a hospital operator, but also I think we've got to realize that the Medicaid doesn't cover much already, and so what are we really going to do with these children and these elderly and disabled folks? We need to answer this as a state.
I agree, and I think in some of the meetings that I have been in recently, and they're showing the graphs of where the most expensive Medicaid care. Do you know where that is? That's in the NICU.
Oh yeah.
That
Absolutely.
is an infant that
Yes.
will live or die by that care.
Yeah.
And that to me is like an aha moment that we would not be supporting that. And that is a high cost, granted it is. But would you say no?
Right.
And so I think we've got to find the solutions. And I know in the sectors that I have been in, that typically we have robbed Peter to pay Paul, and those days are over, because we don't have we can't rob Peter because Peter doesn't have anything. Yeah. And even the providers are saying that. They're saying, I'm not going to go after education money. They don't, we're all at bare bones. So solutions are definitely in order.
Right.
And they may be solutions that some of us might not fully embrace.
Right. Well, I think the discussion this last week in the legislature, it was a patchwork solution yet again for just 1 year. But it was a bridge. This year was really a bridge. We looked at it as hospital operators as a bridge year to get us to the regional care organizations. And now that is effectively off the table until we figure out, because there's not, these regional care organizations were separate companies and organizations, not-for-profit organizations that were going to manage populations it was divided up in 5 regions of the state. But they needed a certain funding level to get off the ground, and the legislature's decision this week kind of takes that away. What I would tell you is most of the physicians in our county take care of Medicaid.
They do.
And they will probably take a cut in payment if things go as at least currently projected. It is very hard to project right now. I am not envious of those in the Medicaid office down in Montgomery right now for the work that they have in front of them.
Yeah.
But
and I don't think people have been envious of their work for quite some time, because it has been, as the development of these innovations, as the reform of Medicaid has been moving along for the last couple of years, 2 or 3 years. It creates again those challenges of how are we going to make this happen? The expansion of Medicaid, regardless of how you feel about that. But there are dollars that the state of Alabama, millions, dollars that are going somewhere else to support somebody else's expansion.
Yes. I'm fortunate enough to sit on the Medicaid steering committee for the Alabama Hospital Association. And so we continue to work on explaining to the legislature and the public the benefits of an expanded Medicaid program. And in all reality, there are some savings, not net savings, but incremental savings on current Medicaid programs that we already pay for, that through an expansion, those costs would go away. So it is still several $million dollars, tens of millions of dollars, to expand Medicaid. But ultimately, it's an economic investment.
It is.
And that it has positive results. And now there are studies out there arguing both sides, but I think the one from UAB, as you said, 2 or 3 years ago, is probably the most well thought of study and reliable. And so my hope is at some point there will be enough political willpower to take this step. It's certainly, to me, certainly something that deserves being talked about in open forums, much more so than it has been, at least in recent months.
And that's one of the reasons we're so thankful that you are here today, and your advocacy and that of the Hospital Association and getting the word out about what this means, what does this look like, and even many of the advocacy groups that we're connected with that are trying to characterize Medicaid, the Medicaid population. There is an ongoing marketing program where I am Medicaid, and I think it may be my next door neighbor that's Medicaid, you know. It may be me that could be Medicaid, depending on the circumstances that my life turns on. Or I might be one of those individuals that's in the gap. You know, I don't have anything. I tell a story of a young woman who came to us when we were doing the sign up for going into the marketplace to see, and she had been an employee of public health and had lost her job with the downturn in the economy, and she was working at one of our fast food restaurants 24/7. She had 3 children, and she was in the gap. And to see her, I mean, she said, what am I teaching my children? I guess I'm going to teach my children that, you know, why bother? That it was a very, again, one of those moments where you go, there it is.
Sobering, I'm sure.
It is, very much so.
Well, we're going to take a quick break and come right back and finish up and talk about some specifics that we want people to know and think about, and if they'd like to call their legislator or talk to someone at their hospital, who that would be. So come right back and join us.
The greatest threat to law enforcement isn't criminals, it's drivers. Roadside crashes are the #1 cause of death for police and state troopers. And not just them. Tow truck drivers, maintenance workers, risking their lives every day. Alabama's Move Over law requires you to safely move over when you see flashing lights on the roadside. And if you can't move over, slow down. Drive safe, Alabama. A message from your Alabama Department of Transportation.
What time is it? It's Toyota time at Toyota of Sylacauga.
This is a great time to own your new Toyota from Toyota of Sylacauga. We have truckloads of new inventory arriving almost daily. We provide transparent pricing, great service, and a no-pressure buying experience. Right now, all new 2016 RAV4s, Corollas, and Camry have big discounts, plus 0% financing available.
We're your small town dealer with big time savings. Online 24/7 at ToyotaSylacauga.com.
Camping World, the #1 RV and camping expert, would like to introduce you to a whole new world. Say hello to new thrills. Get to know your crew. Moments become great memories. Take a new look. Enjoy freedom. Discover amazing. Say hello to a whole new world. Visit campingworld.com.
The gift you've been looking for is waiting at Carden's Gift Cottage on West Fort Williams. Our friendly staff will show you cool raincoats and all kinds of carry bags, neat signs and heavenly scents, colorful lamps and fun beds for the kids, custom car tags and monograms and just about everything. Plus, new items show up all the time. We'll even wrap it for you too. Heck, we'll even rent you a U-Haul trailer or truck to get it all home. All this, and we make keys too at Carden's in Sylacauga.
Well, thank you for coming back with us today and talking more with Joel Taylor and Margaret Morton. I'm Lori Corley, and we're talking about Citizens Baptist Medical Center and all of the changes you've been going through, but also Medicaid. And we were talking a little bit before the break about what people can do to make sure their voice is heard, however they feel. How do they let their voices be heard?
Well, I think, one, I would encourage people to research about Medicaid. Alabama Hospital Association website has just a library of resources about Medicaid. And we're obviously proponents, but it's very factually based. Yes. And so I would suggest looking there to start. So to educate yourself a little bit about it, because this is an issue for the entire state. This is not hospitals. This is not physicians. This is going to impact us all pretty dramatically. And so I think educate yourself a little bit, form an educated opinion, and then reach out to your state and local representatives. They want to hear from you, because Margaret, Lori, you guys, you probably work in Montgomery on a regular basis. I know you do. And so what I hear when I'm talking to state and local legislators is they want to hear from their community members. They see them on occasion, but if people have a passionate opinion on something, they're willing to listen. I've found that true across the board with those that I've interacted with.
I agree, and I think particularly in our corner of the world,
yes,
we have a very receptive group of individuals. But I'll agree with you. Time and time again, it will be said, "Well, I'd like to hear from." You know, I always hear from you. You're
right.
always ringing my phone. I'd like to hear from others,
right.
and just that personal story changes opinion. It makes a difference. They're in the district now because they're adjourned, and from what I understand, that's a good time
Absolutely.
to give them a call. You know, let me talk to you about my concerns, that sort of thing. So yeah.
And I'm sure Glenn would agree. I mean, he and I spend a lot of time thinking about this and how it's going to impact our business and our community and our patients. And so we're a resource as well. But ultimately, we're here to take care of the community. And that's what we're going to continue to do. I think what is, for me, what I would love to see the legislature do is find a solution that gets us to that beginning step on the regional care organizations. Really, we've already taken the initial steps. It's giving us enough momentum to pull the trigger and see what that looks like under the scenario described earlier, where you have a much more managed approach to this patient population. I think we would see better utilization of dollars, of resources in that end.
And I think the regional care organizations are they're reaching out to all sectors in trying to bring, what are solutions for Talladega County? What are solutions for another corner of the world? You know, what works in one place may not work in another, but that whole idea of that we collectively can solve our problems. And this gives us the mechanism to do that. We just need to have the opportunity to do it. And I think we can do it well. And ultimately, we get back to the individual, but the system too, because this is system change, and it just gives us the opportunity to be a part of that. Everybody, citizens, providers, everybody has a place at the table. We just need to get to make sure we're at the table, and
we've seen great success with the Medicaid waiver programs for elderly and disabled, technology assisted. I know at East Alabama, we had at the Regional Planning Commission, there are over 600 people on our Medicaid waiver system. And so that system is one that keeps people staying at home in the least restrictive environment so that they're not institutionalized in a nursing home. And the cost savings on that, it really speaks to also, if I can relate it to inpatient and outpatient dialysis. So those systems have been in place for a while and they're working. So let's look at those things.
Exactly.
And how do we expand that kind of thinking? How do we continue to work together as providers to, and we've said it, but the Get Healthy Talladega table that we can all sit at, we are fortunate to have it within Talladega County that two hospitals have a friendly competition, that we are here to provide, but we can sit down and collaborate, and that we have a number of pharmacies and home health providers, and yet ultimately the health resources available just within Talladega County are tremendous.
Yes.
And so Medicaid is a problem that we'll find a solution to one way or another. My hope is the legislature helps us in that solution soon. So.
And again, the timing is everything.
Absolutely.
And timing is an issue now in terms of an immediate solution. And I agree with you totally, Joel, that we can't just cobble this together. We need to have, and there are plenty of people like yourself and others who understand it and can bring those solutions to the table in terms of the financing piece of all that. We just want to be given the opportunity to do that. So it lies in the hands of the governor and the legislature. And so we'll see. I guess stay tuned, huh?
That's right. We may be doing a similar show in 3 or 4 months.
Yeah. So. But it also, really, we do want to encourage people to talk to more people, to educate themselves, to call SAFE, and any of the providers that they see scroll across the screen for the Get Healthy Talladega County Network can provide a source for information on what people need and how we can help them get what they need. But also to take those preventative steps, those chronic conditions that need to be managed before they get to the point that they have to come to the hospital.
Absolutely.
And how our care coordination can work through that with them through both of the hospitals to make sure that they're able to stay in the least restrictive environment, because that is the cheapest environment for them to be in. All right, well, thank you so much, both of you, for being here today. We really appreciate it. We'll be back. I think we're going to have another session on Medicaid, maybe more about Medicaid waiver and some other things in the coming weeks, so we'll talk more at that point. So thank you for joining us today on the Get Healthy Talladega County Show. We'll see you soon.